Climate change is one of the most serious challenges that the world is facing in the 21st century. Climate change increases the frequency and intensity of extreme weather events, such as heat waves, etc., resulting in increased mortality and morbidity of heat stroke, cardiovascular disease and other chronic diseases, and a variety of infectious diseases. In the context of global climate change, the global project on piloting climate change adaptation to protect human health is carried out in 7 developing countries under the funding and guidance of GEF, UNDP and WHO. In China, the project focuses on heat waves and health through establishing an early warning system and promoting health education to enhance the capacity of the health system and the public to respond to heat waves. 4 pilot sites were selected from 6 climate zones in China, including Harbin, located in the temperate continental climate zone, Nanjing in the northern subtropical monsoon climate zone, Chongqing in the middle south subtropical humid monsoon climate zone, and Shenzhen in the southern subtropical maritime climate zone. The project team collected and analysed the historical data on meteorology, air pollution, mortality and morbidity et al. The quantitative relationship between the heat waves and the mortality and morbidity of different diseases were analysed by the generalised additive model to establish an early warning system on heat waves and health risks. The stability, accuracy, scientificity and feasibility of the early warning system have been evaluated by experts. Application software has been made to predict the relative risks of cardiovascular disease, respiratory disease and heat stroke et al. In the next 3 days. Meanwhile, a multi-level response guideline for heat wave and health risks has been compiled, which standardized and clarified the responsibilities of various departments and response process. In August 2013, the early warning system of heat waves and health risks was put into operation in the 4 pilot sites in succession. Project Office was set up in each site, and a special person was assigned to conduct the health risk prediction of heat waves. The predicting outcomes were judged by experts and health officials, and released to schools, communities and health systems through electronic display, phone message, messenger software, meteorological observatory, and other forms. Depending on the warning level, the local CDC, hospitals, community health centres, communities, schools and the public shall make the appropriate emergency preparedness and response measures, provide public places to prevent from heat waves, timely adjusting school outdoor activities, carrying out heat wave-related disease surveillance, provide consultation about how to prevent heat stroke, increase care to vulnerable populations, provide medicines to prevent heat stroke, etc. In order to improve the awareness and capability of the health system and the public to respond to heat waves, various forms of distinctive health education activities specific to different groups of people were carried out in the pilot sites. In order to assess the effects of health education and promotion, 2 surveys of KAP related to heat waves and health were conducted among the community residents, primary school students and health system personnel in each pilot site before and after the implementation of project activities. The comparison of the 2 surveys showed that the awareness rate of heat waves, willing rate to participate in response to heat waves, and the rate of correct response to heat waves were improved in all the 3 populations involved in the project activities. In order to comprehensively evaluate the effect of project implementation, VRA meetings were convened respectively before and after the intervention in pilot sites according to the VRA methodology recommended by UNDP and WHO. The comparison of the 2 meetings was used to qualitatively and quantitatively evaluate the change in health system vulnerability to climatic change. The results showed that after the implementation of the project, the average VRA score of the pilot sites increased by 52.3% compared to before the intervention, which means that the health system vulnerability to climate change were reduced through the GEF project implementation in 4 pilot sites. In April 2014, China successfully hosted the International Conference of GEF, UNDP, WHO project in Shenzhen. The experts and officials from WHO, 5 project member countries and related institutes of China attended the conference. The China GEF project team introduced the achievements and experiences in the early warning system on heat waves and health risks, health education and health promotion. Participants visited the operation fields of the early warning system in Shenzhen, as well as the project demonstration communities and schools. The conference promoted the communication and achievements sharing among the project member countries. Since the project is undertaken, the following achievements have been achieved. 1. Set up 4 community-based pilot bases of comprehensive intervention of heatwave and health adaptation. 2. Set up a multi-sectoral cooperation mechanism in pilot sites, providing a well-established platform for the implementation of GEF project and other related projects. 3. Established the early warning system on heatwave and health risk and developed the application software. 4. Developed a set of heatwaves and health impacts publicity materials for health education and health promotion training. 5. Reduced the health system vulnerability to climate change. 6. Improved the capacity of health system and community residents to respond to heat waves. 7. Promoted the health sector to integrate the early warning system on heatwave and health risk into the public health emergency system, so as to further perfect the disease prevention system of the health system.